Hi, my name is Allison, and I'm a second year SLP graduate student at Samford University, and this is my co-host, Chandler. But today I will be talking about a compensatory strategy specifically for dysphagia called the chin tuck strategy, or the head flexion or chin down posture. The basic synopsis of this maneuver is that the patient will tuck their chin down before they swallow. According to our author in our textbook, the head flexion has been suggested to help facilitate an improved airway protection for patients who demonstrate deficits in airway protection during a swallow. Basically, what this maneuver does anatomically is improve the laryngeal vestibule closure, narrow the oropharynx, and reduce the distance between the hyoid bone and the larynx. However, this procedure does not produce benefit in all patients and may actually be inferior to thickening liquids in some patients. Although these anatomic adjustments have been demonstrated in response to this posture, the physiological changes have actually been reported to be somewhat minimal and may be contraindicated in some patients. For instance, our author in our textbook mentioned that if the patient is lying at a 60-degree angle and they facilitate the chin tuck maneuver, that this will actually cause more problems with the swallow respiration cycle, causing a longer period of swallowing apnea. This technique can also be combined with other strategies, such as a supraglottic swallow, or, as Chandler said in her video, with the chin or the head turn. In a different study that I found called The Effectiveness of Chin Tuck Maneuver to Facilitate Swallowing in Neurologic Disorders, they stated that this maneuver does not modify the physiology of deglutition, but it does change the pharyngeal dimensions to help direct the bolus into the pharynx. It's mostly employed as a postural maneuver to treat the oral and pharyngeal phases of swallowing. And literature has supported that those who have a neurologic deficit often will have a delay in the swallowing trigger, and that this maneuver is actually beneficial for those types of patients. In this specific study, they analyzed 35 different patients with a neurologic dysphagia. They used the O'Neill severity scale to help determine the severity of dysphagia that they had. And while doing so, they determined the effectiveness of prevention while utilizing the chin tuck maneuver with these types of patients. And what they found was that those who had a delay in the triggering swallow had an 81% prevention of aspiration while utilizing the chin tuck maneuver. And they also assessed, again, those who had different types of severity. For those who had a mild dysphagia, they had a 100% prevention of aspiration utilizing the chin tuck maneuver, whereas those who had a severe type of dysphagia only had an 8% prevention utilizing the chin tuck maneuver. So the basis of this article basically states that the more severe the dysphagia, the less effective this type of maneuver will be. In a different study that I found, named the Chin Tuck for Prevention of Aspiration Effectiveness and Appropriate Posture, what this is stating is that this maneuver has been used since the 1970s, and initially researchers recommended the patient have their chin down at a 45-degree angle. Basically, again, what this does is it changes the anatomy to where the tongue and the epiglottis are now closer to the posterior pharyngeal wall, which further narrows the airway to help with airway protection. And in this article, what they did was they decided to look at the different angles to use for this maneuver, and they came to the conclusion that a degree of at least 17.5 was needed to show some type of benefit utilizing this compensatory strategy for those who had difficulty with airway protection during their swallow. So now what I'm going to do is I'm going to have Chandler demonstrate. Again, what I need you to do is before you swallow, you need to tuck your chin down and then swallow. So if you would go ahead and demonstrate. Good. So as you see, she held it in her mouth, the bolus in her mouth, tilted her chin down, and then elicited the swallow. Therefore, further increasing her airway protection during this time. The articles that I used, again, for this maneuver were the effectiveness of chin tuck maneuver to facilitate swallowing and neurologic disorders, as well as chin tuck for prevention of aspiration, effectiveness and appropriate posture, as well as our textbook, Dysphagia, Clinical Management in Adults and Children. If you have any further questions, please feel free to either contact us at Stanford University for further information. I hope this proved to be beneficial, and I really do hope that you use this in your future studies. Thank you.